Have you ever truly considered what is happening inside your arteries right now? Those vital tubes carrying oxygen and life throughout your body? These quiet vessels tell a profound story about your long-term health, more than almost anything else. Today, we will explore blood pressure and artery health, focusing on how to maintain a strong, flexible, and youthful circulatory system for decades. Whether you are 30 or 70, this video will help you understand your blood vessels and what you can do to protect them for the long run. Let's begin by understanding what your blood pressure numbers truly mean when your doctor says your blood pressure is 120/80. The top number, known as systolic pressure, represents the force when your heart beats, typically between 90 and 120 millimeters of mercury in healthy adults. The bottom number, diastolic pressure, is the pressure when your heart rests, ideally between 60 and 80 millimeters of mercury. Blood pressure is like the water pressure in your home plumbing. Too high and the pipes wear out. Too low and nothing reaches the top floor. Your arteries are living tissue, not steel pipes. They expand and contract with every heartbeat, with healthy arteries expanding by up to 10 to 15% per beat. When pressure stays high for too long, it damages the artery lining, the endothelium, leading to plaque buildup and stiffness. This condition, known as atherosclerosis, can start as early as age 20 in some individuals, increasing risks for heart disease, stroke, and kidney failure. Most people only think of blood pressure as a number, but how your arteries respond to that pressure is equally crucial. Healthy arteries are elastic, like rubber bands, stretching slightly with each heartbeat to cushion the force and ensure smooth blood flow. As we age, or due to poor diet, smoking, chronic stress, or inactivity, arteries lose this flexibility, with arterial stiffness doubling every 10 years after 40. This stiffness further raises blood pressure, creating a vicious cycle where high pressure doesn't just come from the heart working hard, but also from inflexible arteries. The good news is, you can significantly improve artery health through small, consistent habits. Moving daily, even brisk walking for 30 minutes, improves circulation, reduces arterial stiffness, and lowers systolic blood pressure by 5 to 8 millimeters of mercury. Eat for your vessels by focusing on foods that reduce inflammation and improve blood flow, such as fruits, vegetables, nuts, olive oil, and fatty fish. While salt isn't inherently evil, too much sodium, especially from processed foods, combined with too little potassium, is the real issue. Manage stress intentionally through techniques like deep breathing or mindfulness, which can cut cortisol by 20% and calm your nervous system. Prioritize quality sleep, aiming for 7 to 9 hours nightly, as lack of sleep can elevate blood pressure by 10 to 15% the next day. Stay hydrated with 2 to 3 liters of water daily to maintain vessel flexibility, and balance your intake of stimulants like caffeine and alcohol. Let's address body composition. Carrying extra abdominal fat makes your heart pump harder and keeps your arteries under higher pressure. Excess visceral fat can raise blood pressure by 5 to 10 millimeters of mercury per 10 kilograms, impacting your vascular system's efficiency. Even losing just 5 to 10% of body weight can significantly lower blood pressure and improve endothelial function by 15 to 20%. The most effective way to achieve this is by combining moderate physical activity with portion-controlled, nutrient-dense meals. Cut back on sugary drinks and late-night snacking, as they are silent pressure boosters that contribute to arterial damage. Now let's unpack the 3 S's that silently attack artery health: salt, sugar, and stress. Not all salt is the enemy, but processed foods, which account for 75% of our sodium intake, are sodium bombs that spike BP by 5 to 6 mmHg. High blood sugar, often from added sugars exceeding 25 grams per day, damages arterial walls and accelerates atherosclerosis by 2 to 3 times. Every stressful moment triggers adrenaline and cortisol, causing temporary blood pressure spikes, and chronic stress elevates BP by 4 to 9 millimeters of mercury. When people start caring for their artery health, significant improvements appear within 4 to 12 weeks. Morning headaches fade, energy levels rise, sleep improves, and blood pressure readings can drop by 10 to 20 millimeters of mercury. Remember, you don't need perfection, you need consistency, as your arteries respond to every healthy meal, walk, and deep breath. They are forgiving if you give them time, and long-term consistent habits can extend vascular youth by 10 to 15 years. The ultimate goal isn't just a perfect number on your monitor. It's living long and strong enough to enjoy the moments that matter most. Every heartbeat is an opportunity to nurture your body's most vital network, reducing cardiovascular events by 25 to 35%. So start today. Walk a little more, stress a little less, eat a little cleaner. Because your arteries don't care about quick fixes. They care about what you do most days, not just someday. Stay consistent, stay curious, and keep your heart working for you, not against you.